chronic sinus problems know it can affect your overall health, even your mood. There are different treatments out there, but one in particular we're going to be talking about this morning is providing lasting relief without all of those medications. Joining me to talk about that is the founder of the American Sinus Institute, Dr. Vincent Onrubia. Good morning to you. Thanks for being here.
Good morning.
We're talking about something you actually developed. How intriguing. What is it?
What it is a new way to open your sinuses without going to a hospital or traumatizing you and creating damage to your body. That allows us to open the sinus by compressing the tissue using these little balloons we have.
Well, let's talk about those little balloons. You brought in your device, and you can kind of give us an idea of how it works.
These are the two units we use. This little wire has a light at the tip.
So you can see exactly what you're doing.
Knows exactly where the natural opening of your sinus is, so we put the little wire in, then we put the balloon over. You guys can see it here. I don't know if you can see it or not, but the balloon.
We can see it.
It's a very tiny balloon that inflates and makes space in your sinus so that sinus pressure, headaches, drainage, sleeping can all be improved by compressing the tissue in your nose and creating more space so you can accommodate your allergies and symptoms better.
Now, how would you undergo this? Is this something that you could do in an office, or would you need to be put to sleep to undergo this?
We developed the Onrubia technique. That is a procedure that uses this device that was developed by Johnson & Johnson in a way that prevents you from going to the hospital. It's done in the office under anesthesia, because to put this device in your nose while you're awake, which is what oftentimes is done, is very traumatic. So we provided a system that allows better patient comfort, better patient outcome, and by using our systems we have done the most in the country of this procedure.
Wow, so it sounds like successful if you've got that many people doing it.
Yes.
Who is the ideal candidate?
The ideal candidate is someone that finds themselves going to the pharmacy, doing over-the-counter antihistamines, Allegra, Claritin, all the ones everyone knows the names of, that has to take medicine frequently to become symptom-free. Also people that have headaches, drainage, chronic infections, snoring, sleep apnea. All these people can benefit from getting more space in the nose using these small balloons.
And we see symptoms like high blood pressure, but that would come into play if you had sleep apnea or something where it's causing other kinds of problems.
Correct.
Are there any problems that you see with this, or any concerns at all to undergo this? Because you always have to ask.
I think at the end of the day, this procedure is very safe, well tolerated, and is something that has a low complication rate. And in addition, being done in the office allows you to control how the patient is experiencing. So patients, from our perspective, they know they're going to come to our office. We're going to be able to get the procedure done at the correct time. There's no waiting around. There's no emergency in a hospital that may preclude your surgery. Very effective.
And how about long-term effects? Is this something you're going to need to undergo time and time again, or is this a one-time wonder?
It's a one-time correction, because that balloon, although it looks soft, when it becomes inflated, is very hard. Reshapes the bone and reshapes the openings in your sinus in a permanent fashion that lasts forever once it's corrected in the correct fashion.
And as a medical reporter, I know one thing people always ask me is, well, is my health insurance going to cover this?
Yes, this is covered by all major health plans. It's covered by the insurance, it's covered by Medicare, and it's a well-accepted procedure nationwide.
So that definitely helps for people with the old pocketbook. And then what about time out of work? How long will you take to recover from this?
These patients oftentimes are done in the morning. If they're very aggressive and need to go to work in the afternoon, can. I don't recommend that, but some people do. For sure, the next day you're able to attend your work and do your stuff in terms of heavy activities, maybe a week off. But with this procedure, there's no bleeding, no bruising, no packing in the nose. So versus the old procedure that worked but was a little more traumatic, this works just as well or better without the trauma.
All right, Dr. Onrubia, very intriguing. We'll put some information about this on our website at myfoxhouston or fox26houston.com. Great to see you.